Catheter-associated urinary tract infection, CAUTI. Device-related healthcare-associated infections and surveillance. Healthcare-associated infections, HAIs. 1. Healthcare-associated infections, HAIs, is an infection occurring in a patient during the process of care in a hospital or other healthcare facility which was not present or incubating at the time of admission. 2. HAIs may be caused by infectious agents from endogenous or exogenous sources. 3. Endogenous sources are body sites, such as the skin, nose, mouth, gastrointestinal, GI, tract or vagina that are normally inhabited by microorganisms. 4. Exogenous sources are those external to the patient, such as patient care personnel, visitors, patient care equipment, medical devices or the healthcare environment. First principle of infection prevention. At least 35–50% of all healthcare-associated infections are associated with only 5 patient care practices. 1. Use and care of urinary catheters. 2. Use and care of vascular access lines. 3. Therapy and support of pulmonary functions. 4. Surveillance of surgical procedures. 5. Hand hygiene and standard precautions. Urinary tract infections. Healthcare-associated UTI infections. Urinary tract infection, UTI, causes approximately 40% of hospital-acquired infections. Most infections due to urinary catheters, 25% of inpatients are catheterized. Leads to increased morbidity and costs. Prevention of catheter-associated urinary tract infection, CAUTI. 2 main principles. Avoid unnecessary catheterization. Limit the duration of catheterization. Is one catheter better than another? A. No significant difference between latex and silicone catheters. What about coated, impregnated catheters? The concept, prevention of biofilm formation. Pictures of biofilms on silver-coated catheters. Catheter insertion and maintenance. Practice hand hygiene. Before insertion of the catheter. Before and after any manipulation of the catheter site, catheter insertion and maintenance. A. Insert catheters by use of aseptic technique and sterile equipment. B. Cleanse the martel area with antiseptic solutions as unnecessary routine hygiene is appropriate. C. Properly secure indwelling catheters after insertion to prevent movement and urethral traction. D. Maintain a sterile, continuously closed drainage system. A. Do not disconnect the catheter and drainage tube unless the catheter must be irrigated. F. Maintain unobstructed urine flow. G. Empty the collecting bag regularly, using a separate collecting container for each patient, and avoid allowing the draining spigot to touch the collecting container. H. Keep the collecting bag below the level of the bladder at all times. I. Do not routinely use silver-coated or other antibacterial catheters. J. Do not screen for asymptomatic bacteriuria in catheterized patients. K. Do not treat asymptomatic bacteriuria in catheterized patients except before invasive urologic procedures. What you should not do to prevent CAUTI. A. Do not use, avoid, catheter irrigation. B. Do not use systemic antimicrobials routinely as prophylaxis. C. Do not change catheters routinely. Thanks for watching.